Oh my gosh, I didn't even realize we were going. Okay, we are the Mavericks, and we had Patient Point. We interviewed Raj Taleti.
Okay, Patient Point is a healthcare software firm. It collects and sorts patient data and then analyzes it. And through there, it sends it out to physicians and patients through a mobile application, also through interactive displays in hospitals and clinics. And it's pretty much compatible with any other healthcare software on the market. So it can collect data, sort it through, and then make it more accessible for everyone. It's currently used by 61,000 physicians in 750 hospitals, uh, which accounts for roughly a half billion patient-caregiver interactions annually, allowing for better healthcare outcomes. And it currently employs about 600 people, though it is continually growing. So you can't see in the video, but we have a just display of how it works in practice. It's in hospitals, right in waiting rooms, in the actual rooms themselves, at desks. It's just a very interactive feature for people to use when they're in hospitals, throughout hospitals, and then bring back home with them. So.
So this is Raj himself. His both parents were physicians and business owners, and he also has his bachelor degree in mechanical engineering and his master degree in industrial engineering. He is also very experienced in the area of computer programming.
So,
given all of his strengths in engineering and computer programming, and given that his parents were both entrepreneurs, he decided to follow that path. He started in '95 working for Microsoft as a program manager for their healthcare consulting software. He won an award there, pretty distinguished. In 1998, he started Cytura, which is another healthcare technology firm. Won a lot of awards there and was acquired by Mobius, a pretty big healthcare software firm. After that, in 2002, he founded Galvanon and stayed there as CEO until 2005. Galvanon was the first commercial self-service healthcare kiosk. You may have actually used it in your healthcare experiences in the past. It was pretty successful and acquired in 2005 by NCR, a fairly major player in that industry.
so the idea was first developed while Raj was at Galvanon. He said it was almost a natural progression. Then in 2010, he actually launched Patient Point, the company. In 2011, the Star Quality Improvement Engine, the software, was launched. And then starting in 2011, that same year, excuse me, they actually started working with hospitals and installing them in there. In August of 2013, they partnered with a major pharmaceutical company for the first ever clinical trial use, which is a really big deal. And then in December of 2013, they won the National Health Information Award. So some issues that they had, Raj talked about, financial. Obviously, coming off of Galvanon, he made a whole bunch of money, and so self-funded for the first 2 years, but quickly realized with the size and the pace of the industry moved, he needed to find a VC to partner up with to get some more strong financial backings. The second thing he talked about was customer engagement. The product itself is dependent on customers knowing, believing in the strategy, and really just understanding why they're using it. And then the third was that the industry is moving at a super rapid pace, so anything that they introduce to the market they know it needs to work.
So Raj's goal for the organization is basically launching worldwide. He hoped that at the end of 2015, it will be over 1,000 hospitals using his software. And personally, he also wants to create job opportunities in his community. And right now, he's already creating over 1,000 jobs.
So some major takeaways from this interview. One was that networking is extremely important to be successful in business. The second was that for funding, you need to make sure you find investors that you can work with long term, people that you like. And then the third was the minimum viable product, just really going out there and testing your idea rather than writing up a business plan or anything like that. And the fourth thing was passion. You just need to have a driving force, something other than money. So Raj, obviously with the experience that he had, this being his third major startup and successful, there weren't a whole lot of critiques that we could think of. The only one that stood out to us was just the developmental lag, the fact that he took or had a 5-year gap from when he first thought of the idea to when the company launched, and then another year for the software to launch. We thought with his skill and expertise, he could have moved along much quicker than that. So,
Any
we have questions now, but obviously not, so thank you.